this virus do not stay in hot weather. So being exposed in the sun, I think, is something good for everybody. Welcome back to my channel. In view of COVID-19 or coronavirus, Qatar has strengthened its precautions and preventive measures with regards to the spreading of the virus. Hello everyone. Despite of the coronavirus spread here in state of Qatar, we still have to continue our daily life. We cannot just stop just because of this coronavirus. So today I am bringing you with me with my routine or daily life here in Qatar, even there is coronavirus. As you can see, on the door of the porta cabins here in the project, almost all of the doors has the instructions for preventions or precautionary measures to be done with regards to the coronavirus. So I'm here today at Al Rayyan Stadium project for a site visit. Let's take a look around on how the people and the workers of this project is applying the precautionary measures that has been advised by the MOPH. Now I'm in the level 2 of the stadium. You can see it behind me. This is the Al Rayyan project for the Al Rayyan Stadium that we are visiting right now. Let's check with him how they are coping up or trying to prevent themselves from this coronavirus. So we have this gentleman with us. What's your name? Enoch. You're from where, Enoch?
Ghana.
He's from Ghana and he's one of the, what's your position here in the project?
Scaffolding inspector.
Scaffolding inspector. Alright. As a scaffolding inspector with this coronavirus that is happening in the country, what do you do to prevent yourself so you will not get infected from it?
As you can see, I've already protected myself.
Can you tell them and share them?
Oh, as you can see, this virus is very, very dangerous. And the way this disease is every day increasing, if you didn't protect yourself very well, I think you may not find yourself easy.
So what they should do, to protect themselves?
They should follow what the World Health Organization has approved. We should follow that procedure so that we can protect ourselves.
Guys, I'm in the middle of the sun. In this weather, I believe this is something good for me because they said that this virus do not stay in hot weather. So being exposed in the sun, I think, is something good for everybody. So here we have another guy working in this side. What's your name, my friend?
My name is Kalu.
What?
Kalu.
Kalu. Alright, Kalu, do you know about this coronavirus?
Yes.
Okay. What do you do to protect yourself, Kalu? So you will not get infected from it?
Too much problem coronavirus.
Too much problem coronavirus. Are you scared?
So, yes.
Face cover. Are you scared? Why? Why are you scared from the virus? Virus dangerous, yeah? As a result of a rapidly evolving situation relating to coronavirus or COVID-19, a number of changes have been made as precautionary measures here in Qatar. As per MOPH, Primary Health Corporation or PHCC will be implementing the precautionary measures as of Sunday, March 15. As of March 18, 2020, Rodat Al Khil Health Center will be a test and hold COVID-19 facility. As part of combating the COVID-19 pandemic, the government has ordered a temporary closure of retail shops, barbershops, and salons, including the home services, massage centers, and malls, except supermarket and pharmacy. Restaurants and cafes are still open, however, they will only serve for takeaway or delivery. Ministry of Commerce and Industry stresses that perpetrators who violate or breach this decision will be held accountable. Partial closure of industrial area from street number 1 to street number 32 for a period of 2 weeks, subject to extension. As for Qatar Airways' statement, under the instructions of Qatar government, entry to the state of Qatar will only be allowed for Qatari nationals, and they will be required to enter the quarantine of 14 days. Hello guys, I'm here with Khaled. He's one of the owner of one company or contracting company here in Qatar, and we would like to check with him what is his view with regards to this coronavirus. So Khaled, what is this coronavirus?
I talk in Arabic or English?
It's up to you. You can speak in English or in Arabic, but I prefer English so everybody can understand.
This coronavirus, nothing to be scared. Just try to be clean all the time. Wash your hand every 1 hour. Just do that. And keep a distance between you and other people, and keep moving. And when the government asks you to stay at home, if there's in case you stay at home, stay. But you have a lot of things to do outside. Just go to do it and be careful. That's all.
So they don't need to get scared about it.
No.
They don't need to panic as well.
If you keep yourself clean, no need to be scared at all.
Exactly. That's the same point of view. You don't need to get scared. So why these people are wearing masks?
They're wearing masks because they are scared, and masks do nothing for them, to be honest. And if the virus, at least they touch anything and touch them face or nose or something, because this is not coming from the air.
Exactly.
It's coming if someone sneezes or they're touching, sneeze on the table. I come to touch the table, then I touch my face. This is what was happening. If you keep it clean all the time, wash your hand, don't touch your face, and don't go to the crowded area like labor camp or something. Everything will be fine for you.
So nothing to get scared with this coronavirus.
But I'm not a doctor, just say advice, because this is, you have to know, and even any company should advise them labor like that.
Alright. I do not suggest everybody to keep on wearing masks whenever they go outside. Let me show you why. Now I'm wearing my mask. Now I want you to imagine that these powder are the bacteria or viruses. I'm gonna put my hand like unconsciously, let's just pretend, and now I will have it in my hand. You can see that there's a powder in my hand. Now because you don't usually wear mask in your daily routine or your everyday life, definitely there would be a chance that you would need to adjust your mask just like this. So right now, I'm having contact with my face, and my hand has a substance or has bacteria or viruses that I took from this powder, because you can't see the virus or you can't see the bacteria by our naked eye. So wearing a mask doesn't actually protect you unless otherwise you are feeling sick and you are sick. That means you are protecting the other people from getting any bacteria from you, whether it's a normal cough or normal colds. The people who should be wearing masks are the people who's sick, doctors and nurses who's attending patients, and those which is in the laboratory who's more exposed onto bacteria and many things. So for us residents who's living around, it's not necessary for us to put masks. It gives us more higher risk of transmitting or transferring the bacteria coming from our hand closer to our face because of adjusting the mask that we are not used on wearing for our daily life. I suggest that you use gloves when you are in public area so that you will not get scared or conscious on touching any door handles or anything and everything that is exposed to the use of public. If you are wearing gloves, upon entering the toilet, remove the gloves by pulling it on the exposed part Avoid skin contact on the exposed area of the gloves and throw it in the trash bin. Make sure to wash your hands thoroughly for at least 20 seconds. Use a tissue to turn off the faucet after washing your hand and throw it in the trash bin. Use again another tissue to dry your hands. After using the toilet, wash your hands again thoroughly, just like what you did upon entering the toilet. If you're not wearing gloves and your hands are clean, grab a tissue and use it on the door handles to avoid direct contact with your hand. We should disinfect our surfaces such as tables and so on. Now I want to show you how you're supposed to disinfect for example, your table, just like this one. I'm going to show you two things. First, you're going to spray. Normally, what you do when you clean the surfaces is you make like this. As you can see, there are still leftover powder on the table. Once again, we are imagining that this powder are the bacteria or the viruses. So there are still leftover on the table. Now I will show you how you're supposed to clean or disinfect the table. Spray on the area. Now you have to wipe it one like this. You can use the other side or you can fold it whatever you want so long as it's still clean. And two. Now you can see the difference. Here, the tendency of rolling it like this is like letting the powder to keep on rolling or crawling all around the surfaces. Rather than doing that, we must do it in this way by wiping it one time straight on the one side and another on the other side. I mean, like we're gonna do it gradually just to ensure that we are not making a circle or letting the bacteria or virus to be circulating on all the surfaces. Now, what about the mobile? Everybody, children or adult, has their mobile, and we tend to use our mobile and then put it down to surfaces, places that we are not so sure if it's really disinfected or no. And this mobile used to be close to our nose and eyes since we are always putting it in our ear when we use it or when we are having cold. Now I'm going to show you how you're supposed to clean your mobile. Just grab a wipes, antibacterial one. You wipe it like this, one time going down or going up, just one time. You can fold it once again, you can fold it, and then you wipe it from here on this side. Then throw this dirty one. Now your mobile is clean and sanitized as well. As of March 19, 2020, the Ministry of Public Health announces that there are 9,460 people tested in COVID-19 and 460 people are positive for the COVID-19 cases here in Qatar. Department of Laboratory and Medicine Pathology, DRDLMP, Her Excellency the Minister of Public Health, Dr. Hanan Muhammad Al-Kuwari, said the country has appropriately prioritized diagnostic testing and supported the relevant laboratory response network in this regard. The country's proactive program of testing for this novel disease means Qatar has one of the highest testing rates in the world. Dr. Al-Kuwari underlined that Qatar remains open and transparent throughout the testing process. The relevant data is regularly shared on the Ministry of Public Health's website. MOPH in Qatar has assured the public that the patients are being kept under complete quarantine and strict infection control procedures. If you'd like to know more updates in combating COVID-19 here in Qatar, then don't forget to like and subscribe into my channel. Please remember, your safety is my safety. I'll see you on my next video.